Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
And good morning. I'm Dr. Kim Allen Williams, Chair of Medicine here at University of Louisville, and it is my pleasure to introduce the Cardinal Minute. Our grand round speaker this morning was Dr. Chrysalyne Schmults, who is actually a professor of medicine at Harvard University, and she is the Howard and Wendy Cox Distinguished Chair in Dermatology. And she is predominantly at the Brigham and Women's Hospital. And she spoke this morning about management of high-risk squamous cell carcinoma and its precursors. It was really rousing, generated a lot of discussion, rousing talk, and hoping you could summarize it in 1 minute.
Sure, absolutely. Thank you so much. So cutaneous squamous cell cancer likely kills as many people as melanoma does. We don't have precise estimates because there's so many cases, about 1.5 million cases every year in the US. And we think that those result in about 7,000 to 10,000 deaths every year, which is in the ballpark of melanoma deaths. Mohs surgery is a way of looking at the margin, the complete margin under the microscope when you surgically remove a squamous cell cancer. And surgery is our mainstay of treatment. Most of our patients are going to be cured just by surgically removing that tumor. And if you don't do Mohs surgery, then the pathologists are only able to look at about 1% of the marginal surface area. With Mohs, that extra precision of looking at the whole entire margin under the microscope cuts the risk of recurrence and death in half. So NCCN, our National Comprehensive Cancer Network in the US, has deemed that Mohs or an equivalent margin read with a pathologist is the preferred treatment for very high risk squamous cell cancer in NCCN's parlance. And those are tumors that have any one of the following criteria: 4 centimeters in diameter, poor differentiation, invasion beyond the subcutaneous fat, desmoplasia, which is fibrosis of the stroma, lymphatic invasion, vascular invasion, or invasion of nerves that are running either deep to the dermis or that are more than 0.1 millimeters in caliber. And so if a tumor has any one of those criteria, then NCCN says that they really need a Mohs excision. And we would save about 30,000 lives worldwide every year if that guideline is followed.
Well, that's really amazing, and it's great to see such a dramatic improvement in outcomes of patients. So thank you so much for all of the education and the update, and this has been a Cardinal Minute.